Hello, everyone, and welcome to our webinar on women and substance use disorder as it relates to treatment. My name is Sunita Mahase, and I'm the Program Officer for Treatment, Rehabilitation, and Reinsertion. I'm a team member of NADAPP, and for those of you who aren't familiar, NADAPP is the acronym for National Alcohol and Drug Abuse Prevention Program, which is a division of the Ministry of Health. I do have with me today two of the most resilient and compassionate women you can possibly meet to join in today's discussion. They both have been through and weathered their own storms when it comes to substance use disorder. So, in no particular order, I would like to introduce you to Ms. Neela Birjah. Neela, apart from her lived experience, as I expressed earlier, is dedicated to helping women through treatment and recovery. Neela is also the co-founder of the only women's AA group in Trinidad, and that is named the Sober Sisters. We also have the insightful and compassionate Caroline James-Bowen, who along with Neela have lived experience on substance use disorder. So Carol worked at New Life Ministries as a nurse and a peer counselor, in addition to serving as a peer counselor at the Paparo Empowerment Center. So I often receive a copious amount of calls from family members of women who are on substance. Just last week, a young lady reached out to me wanting assistance for her mother, who she states that her mother uses alcohol and it places a strain on the family's finances, as well as her mom constantly steals money from the family to maintain the use of her alcohol consumption. And on the other end, not very long ago, there was a client who shared that she felt ashamed to admit that she was using marijuana. She shared that she abandoned her close friends, and some of her close friends even abandoned her. She felt that no one understood her in that situation. So, having said that, ladies, tell us, how does substance use disorder negatively impacts the women as individuals? So, we'll ask Neela.
Okay, good morning, everybody. Thanks for having us, Sunita. That was a brilliant and very kind introduction. The question that you're asking is very large. There are two parts to that question, and substance use affects an individual in every single way. You've mentioned from that call alone, economically, physically, family life, every dynamic of a person is affected. So the individual usually forgets themselves. So I could speak for myself. I didn't exist when I was on the substance. The substance was the only thing that existed. Having it, getting it, acquiring it, finding a quiet place to use it, that was the only thing that mattered. There's a loss of time, there's a loss of self-awareness, there's a loss of self-esteem. You just lose self. And then, in particular roles now, if you're a daughter, a mother, well, every woman is a daughter. So when you're a daughter, you no longer respect your parents. If you're a mother, you probably would have neglect issues with your children. If you're a wife, the same thing would happen unless you're in a toxic relationship. We can talk about this wholly, like all day, because it affects everything. So a person becomes bankrupt financially, spiritually, socially. It just affects every part of the individual as well as the individual circle. So whoever I was touching, whoever's life I was impacting, they would have been negatively impacted as well, because I'm taking time from them. I'm draining them of their peace. I would drain their financial resources. The list goes on. So the negative impacts of several. It is limitless. And I tell persons who try to come into recovery now that, the maths don't really math, because a substance doesn't really add anything to you. But it subtracts, it takes away from all those things that I mentioned, from your finances, from your physical appearance, from your ambitions, and divides your family. So it doesn't add anything to your life. So why even bother to try it? Take the take heed from persons who've been there before, mild, moderate, or severe. If you think that you have an issue with a substance, try to seek treatment as quickly as possible. I hope that answered your question.
Yes, of course it did. And thank you, Neela, for sharing. And, that explains why the caller would see that she lost a circle of friends and stuff, because you did explain how it impacts your circle that you deal with, right? So, Carol,
Yes, good morning to the viewers, good morning to the listeners, good morning to you all. What Leela said there, she was right, because, I can identify, with some of it, because I remember using and working. And, at a point in time, I had to leave, I started to stay away from jobs, right? Stay away from a lot of stuff. Start to hide myself away from friends, from relatives. My whole behavior changed. My mindset changed. The way I think, the way I behave. My dress code changed. I started dressing, a sort of way that it wasn't appropriate to be amongst human beings. You understand? So it really takes away from you as a person. Plus, as a daughter, I started lying to my mom, stealing, all these different things. The substance started affecting me in all areas, you know. It had times my eating pattern changed, you know, when, this nice food on a Sunday, you get your little crab and callaloo, and you can't even eat because you have no appetite because of the substance. So it really takes away from you. So, I personally will tell women, as Leela rightfully say, if you start using a substance and you see that your pattern, your whole life change, you need to seek treatment as quick as possible, as soon as possible, because it's just a downhill. It's just a downhill. It's not a upper. It's a downhill. You'll be going more down, more down, more down. So it's better you seek treatment before it gets worse. So this is what it is about. Treatment is the goal.
right? So it definitely based on the two
Yes.
responses that I have heard.
Yeah.
It seems that the substance engulfs your life. Yes, it does.
It takes you away from life on the whole. It takes you away from life activities. You'll be interested in things that's happening around you, that is healthy around you. You just keep focusing on just, finding ways and means to get this substance. That is all you think about.
And your circles
And your
obviously
circles,
would
you
progress
understand?
as well. So you would find that if a person starts drinking or smoking a certain amount and their friends don't indulge in the same amount, they would find a circle that have an increased amount of usage. So you change. You don't women especially, they don't involve themselves in relationships with someone who doesn't have the same kind of lifestyle, so that they wouldn't feel judged. It's really easy. I know I'm probably going to jump the gun. It's really easy for a woman to acquire a substance. Very easy, especially within Trinidad. You just have to stand up in probably in a bar or in a club. You don't have a purse on you. You don't have anything on you, and you going home plastered. And it's also very easy for women to become addicted because of our genetic buildup. Our fatty cells don't metabolize substances as much as well as men. So we become more dependent on a substance faster than men would. So we kind of doomed in a way is what I would say. So not everybody who would indulge in a substance would automatically become a person suffering from substance use disorder. However, the risk is high, and even higher for women.
I agree. The risk is definitely higher for women. And that brings me to the other point. Most of the time, we see men going for treatment rather than women. What do you think are the barriers that would hinder the women from seeking treatment?
For me, I could talk for myself. I think basically some of the barriers will be like support system, money, children, your job. Because I remember when I was seeking my treatment, I didn't have a support system. But at the end of the day, when I played the tape at the end, I knew I wanted help along the way. But there was no system to support me, right? I didn't have a job to say money to pay my way through because where I did my program, you had to pay. So I didn't have money, so that was one of the barriers. But still, I didn't let that keep me back from going to treatment. I still went along and took my treatment. But some women, other women, that is some of the problems. They talk about money, financially. They don't have nobody to support them. They don't have the money. Plus, they have the children. Who would I leave my kids with? Right? Sometimes the husband, he might not be working just as well. So all these things, keeps women from going forward to seek treatment. And the main thing, I think most of it does be your children. Once you have kids, that is one of the main things. Who would I leave my kids with? Who will take care of my children? They put the children in front before they, look at their life. Hey, if I don't seek this treatment, what will become of my kids still? And that is a barrier.
Yeah, but one of what I see, what I have seen during my own journey and what I see now working within the field is that the woman, we focusing on the woman, the woman who is suffering from substance use disorder, she's the only one who doesn't see that she has a problem with substance use disorder. So firstly, that is one of the barriers, that self-awareness that we mentioned before doesn't exist. Everybody else around her knows that she has a problem, but she is not yet willing to accept that she has a problem that needs treatment to begin with. Their rock bottom ain't reached yet. So we have to wait until the person is actually self-aware enough to recognize that she has an issue. Then the stigma, obviously, again, there is no stigma attached to a woman getting plastered. However, there's a stigma attached to a woman seeking treatment. And I could speak from experience, 9 years sober, and if I tell someone I don't use, I don't drink, I don't smoke, they look at me weird. But if I if I throwing up in the bathroom, that's normal. So that is wrong side. Trinidad is kind of wrong side in that aspect. So we have to normalize and change the narrative for women to be able to actually say, oh my God, there's no shame for me not being able to handle my liquor. And we're not just talking about liquor, whatever substance it is, that I can acknowledge that this is not for me, and perhaps I have let it take over my life so much so that I need professional help. Now, you don't have to go to a rehab in particular where you have to pay. A woman can attend meetings, AA meetings, NA meetings, Narcotics Anonymous or Alcoholics Anonymous meetings, and meeting makers make it. 90 meetings in 90 days is a healthy alternative. However, making that decision and sticking to that decision that you need help is a barrier because of the stigma you're talking about. A woman don't want to be seen in a room because she don't want to be seen as having an issue. She family don't want to, how it go look. They don't want to make out the scene. They prefer to feed her whatever she needs behind closed doors, keep her a closet drinker, a closet user, and then when it hits the fan and there's no turning back, then the woman is then referred to perhaps St. Anne's or another facility. So the stigma of women drinking, being loose, being bad mothers, just how it go look kind of thing that, that you in rehab for 3 months, so who going to take care of your children, that kind of thing, putting others before yourself. And that's really dishonest from a personal standpoint, because I am also a mother, and when I was seeking treatment at first, I made the excuse of who is going to take care of my child. However, when I was actively using and in trouble, I really wasn't taking the best care of him anyway. So it's just the point of self-awareness and really being honest with yourself, and that is how you go into recovery. Honesty, open-mindedness, and willingness.
As Leela mentioned that, you sent me back to when I was seeking my treatment, because when they came to me, I was like, wasn't thinking about even my daughter, because I had my daughter that I was using. But at the end of the day, I wanted that help, so some parent or some mother or some woman who have kids, right? Because I wouldn't say I was polyaddict, but I was more on crack, and that point of time, I needed that help, so my daughter was not my issue seeking recovery. She was not that, but because I wanted to get that treatment to be there for her. So by getting the opportunity to go to treatment, I took it. The least I was thinking about is who is going to take care of her. I wanted to take care of me.
Right.
So that I'll be able to come out to take care of her. So by seeking treatment, now things were put in place for her to get cared for, so that I was able to go to treatment, so I'll be able to focus, to accept my treatment, so I'll be able to come back out and take care of my daughter. So the stigma and the barriers, in my mind, I really needed that. So I know I'm one of them that didn't allow any barriers to prevent me from seeking treatment.
Eventually.
Eventually, yeah.
Because it could happen. It
No,
could have
with
happened
me,
years
I could
before.
speak about me. Well, in years before, I didn't even know it had
Because
places.
you're in denial. So that's,
No, but if you understand what I'm saying, I didn't even know it had places I could go.
Right.
At that
So
point
that
in
is a
time.
barrier that women
Right?
do not know that
I
there
did
is a
not
treatment
know that
center
there was
available.
that it had treatment center at the point in time when I seek a treatment to go to treatment. Mm-hmm. So while I was in prison, when I was castrated, that is where I know about places to go to get treatment. But it didn't come to me, so I had to accept it. Is after coming out from prison, then I know that, hey, there's rehabs you could go to get treatment.
So as we speak about treatment, I really want to send this question out to you. So in seeking treatment, do you think that it's a barrier when you go to seek that treatment and you're being stigmatized through language? Let's say persons calling you crackhead, coke addict, the list goes on. I mean, have you all ever had experiences like that or met with clients who have had that experience?
Of course. Of course. And that's
So
probably the one of the reasons why women don't seek treatment at first, because they will sit down with their vape or their cigarettes and their alcohol and say, well, I'm not a addict. I don't need treatment because I am not on a harder drug that they assume is a harder drug. But a drug is a drug.
It's a drug.
So that is within the walls of recovery itself. There are stigmas that we're still working on. Mm-hmm. The words that we use. We still stand in meetings and say, hello, my name is Neela and I'm a grateful recovering alcoholic or grateful recovering addict. And the words surely need to change sooner or later, sooner rather than later, so that persons would realize that it is, if you adopt the disease concept or whatever it is, that that you're not responsible for this disease, but you're responsible for your recovery. And when it comes to the clients themselves, what I have seen is they are very harsh on themselves. When I was working at the women's facility, there was one client in particular, when she had to go to a psych clinic, she would say she's going to the vet. So that is, how everything is made kind of a joke. Mental health is a joke, and it's not supposed to be. You're going to the doctor the same way you're going to the dentist to see about your cavities that were created because of your substance use disorder. You're going to the psych clinic because that is one aspect that is incredibly important to treat as well.
All right. So as Carol did say, one of the hindrances was because she was unaware of treatment
Of
options,
treatment options,
right?
yes.
And
Yeah,
like many out there today, the information is limited,
is limited, yes.
right? So today, Carol is going to give us some treatment options, and I will allow Carol to continue from there.
Women in Trinidad and Tobago need to know that we have women rehab for women in Palo Seco, and we have Miss Beverly Cole, where she has her rehab Serenity Place, where they could call in and always get the information, right? The number for Palo Seco is 387 2598. They could always call and get more information. It's a 3 month in-house program, and also after you finish the 3 months program, you'll graduate and it have a 2-year follow-up. Every Monday you have the follow-ups to go to on a Monday.
So a woman with substance use disorder, any sort of substance,
Yeah.
Any sort
Any
of
sort of substance, alcohol, cocaine, cigarette, marijuana, coffee, because there's a lot of women in Trinidad who is addicted.
any mood and mind altering
Anything that,
substance.
yes, and they're addicted. It have some of us who have our normal family and we're addicted to substance and we don't know that we're addicted to
and you
certain
just need
things.
to call.
And they just
Yes.
need, if once they know that they are addicted and they need that help and that support and that treatment, just call and they will get all the further information. To
There's
go
also,
into
you know,
rehab.
we must make mention of process addiction as well, right? So there are many individuals, male and female, who find themselves dependent on pornography,
Yes.
on social media, on gambling, right? So those are also just as bad addictions.
Addiction. No, and simple things. We might say, as Leela mentioned, simple dressing, clothes, shoes, all these things.
Shopping.
People shopping, people are addicted to these things, you know what I mean? And we have to be very careful.
So the Women's Center at Palo Seco would address all
Treats
of
all
those
these
issues.
once it is a disease of addiction.
Yeah. Obviously, there's a process. You know,
Yeah.
I'm a product of Palo Seco as well. That's where I did my 3-month rehabilitation. However, you know, there was a screening process before being admitted. The same goes for the men who
same
try
thing.
to come to Rebirth House, my facility. We do pre-assessments, interviews, figure out what if we can help, and then admit it where necessary. You know, Carol did mention that it is 3 months, a 90-day program. However, if more time is needed,
Yes.
you know, it would be suggested that the client remain for 6 months or 9 months or perhaps longer. You know, it depends on the mental health, you know, if there is any brain damage, if the individual needs to go to St. Anne's or Ward 1 first or be medicated, something, because the substances that are out there right now are incredibly potent and do damage the brain. You know, so, and like I said, the genetic makeup for women is different to men, and you do see a lot of brain damage in women, probably more than men.
As Lida mentioned, if you really look at women on the streets that is using substance, they really, really have this mental breakdown. And it starts with, you know what I mean, sometimes it's not only the drugs.
Yeah.
It starts from, you know, home. You know what I mean? Sometimes you have domestic problems and, you know, because of the domestic problems, it leads into the substance use. You know? So when you look at the streets of any part of Trinidad and Tobago, and you look at women who's on substance, it's naturally a mental problem.
You know, the disease is progressive, but recovery is also progressive. You know, you kind of begin to regain everything in your life. Not even regain, not restoration, but get more. If the client is not willing to get residential treatment, there are virtual meetings so that you could sit in the comfort of your home and plug in an ID and a passcode on Zoom. For Sober Sisters, we meet on a Sunday, Wednesday, and a Friday, and it's completely anonymous. Only women are allowed, and we have as many as 20-something women at a time. I won't divulge the ID and passcode now because we have to verify that it is a female who would be entering the room. So that would be done like on a one-to-one basis. You can, when somebody reaches out to you and you know that they are verified as female and with a problem, then you can share the information. But we do meet 3 times a week. The meetings are hour long. Maybe there you can find out that you're not alone, that you alone don't have all these problems, you know, and seek help. Continue, you know, coming. That's what we say in the rooms. Keep coming. Put yourself first a little bit. When you're in residential treatment, that's the first and last time you probably would be focusing on yourself completely and not having to worry about anything else but getting better. And that's what we want. You know, our focus is on getting, spreading the word, you know, making it, showing people, showing women especially now that it can be done. If you had seen Caroline in her day, if you had seen me in my element, you would not believe that it's possible. You know, all that bankruptcy that I was mentioning earlier, you know, hopefully you will nurture a relationship with your family again, with the God of your understanding. You'll start to have physical ambitions and ambitions for careers and academic ambitions. Everything that it's stripped from us before, it will be restored. And you just have to do it one step at a time, put one foot in front of the other, and just do it, because it is an action program. It's not, we don't have a muscle to flex. We don't have no machine in the gym to tell you how to recover. So it is a daily reprieve, and you have to choose yourself daily, you know.
Okay. I would like to give this message to them who is seeking treatment or would like to seek treatment, that, you know, living is really worth it. Recovery really nice. You know what I mean? So seek treatment as soon as possible, as quick as possible, and live. Just live. Please, I'm begging you women out there, just live. It's worth it.
It is worth it.
It's worth it, yes. We need all the women. We need women. Because really and truly in recovery, you hardly get women in recovery. So we need them in recovery.
I love that. I love that saying. Live.
Live,
Live.
live. We need to
We
live.
need you to live.
Yes.
So Neela?
Yes.
That was such a kind, soft, you know, message to the woman.
Yeah,
And that's
we
exactly
need
what
to
you need, you know. You need to know that there's hope, you're not alone.
Yes.
But, you know, I would be a little more rough and say, you know, we would take every opportunity to find means and methods to get our vices satisfied. Do the same thing for your treatment, for your recovery. Make the same efforts for your recovery. You know, we shouldn't have, it's sad that, you know, we want to be spoon-fed where the treatment centers are, where the meetings are, what the numbers are. But we will do all the research on our own for the negatives. So take that same energy and do it for yourself positively, because there are women in the rooms. You wouldn't believe how many women are in the rooms right now benefiting from the programs of recovery. And we always say, we always have a moment of silence for the still suffering person in and out. And we are praying for you. We are praying for you to come into the rooms or come into the centers and really look yourself and be honest with yourself and recognize that what you're living right now is not life. You know, you're missing out on a lot. And it can get better. You're not in a pit. It can get better. Just ask for help.
Further to accessing treatment services at NADAPP, we are committed to assisting you in finding the best treatment center that will cater to your needs. You can reach us in many ways. One of them would be you can call us directly at 217-4664, and that again would be 217-4664, and our extension 12605 and 12608. You can also visit the Ministry of Health webpage, and there on our homepage you would find under the e-service for the public an information request form that after filling out and submitting, you will be contacted within 5 working days. However, you can also visit NADAPP at our office, 4 to 6 Queen's Park East and Port of Spain. As we come to the end of our webinar, I would like to extend my heartfelt thank you to both Carol and Neela for imparting your knowledge and sharing your stories with us today. So please remember, substance use disorder is a treatable condition and help is available.